Okay, so I'm Maddie. I'm doing my presentation on marijuana and driving. The objectives for this presentation are to define impaired driving or driving under the influence, specifically of cannabis, and also looking at alcohol. We're going to compare the effects of driving under the influence of cannabis to that of alcohol, both physically and ethically, and looking a little bit at the legal consequences. We're also going to look at the laws in some states for how they handle driving under the influence of cannabis, and then also look at the implications that driving under the influence can have not only on the driver's safety, but their passengers and the families of those on the road that might be affected by driving under the influence. So driving under the influence, cannabis does impair your ability to drive compared to that of when you're driving sober. It impairs your reaction time, your coordination, your ability to make decisions, and other skills that are necessary to drive safely and responsibly, which can lead to an increased risk of accidents and other dangers for those on the road around you, as well as anyone who might be riding in the car with you. It is illegal to drive under the influence of any substance such as alcohol or cannabis in the United States, as well as other drugs. Specific laws in each state do kind of vary on how they word and any additional restrictions the states might have on their impaired driving laws, but for the most part, they're all the same in that it's illegal. And then just some food for thought. There have been a lot of like decriminalizations or legalizations of certain drugs such as like magic mushrooms. I know up in Michigan they decriminalized it, I think in like the city of Ann Arbor or Detroit or something. So that's just some food for thought. Might lead to more increased rates of driving under the influence since it is seemingly more accessible with them being decriminalized. So the effects of alcohol, obviously everybody knows about breathalyzer tests and the legal limit of 0.08% for the blood alcohol content. There's the impaired motor skills and coordination and balance that are associated with driving drunk. So obviously there's the test, they'll have you walk on the line, they might have you do the finger nose test, or they might have you do the breathalyzer test. It's pretty straightforward in determining whether somebody is driving under the influence of alcohol. Obviously, you're going to be more irresponsible when you're driving under the influence. Might make you a little bit more careless on the road, and your ability to drive responsibly is just going to be impacted negatively. Obviously, there's a lot of consequences that come along with driving drunk, with the legal ones from fines, jail time, and losing your license, to the emotional ones that might not be as obvious. If you seriously injure somebody or manage to possibly even kill someone, which hopefully is never the case, there's going to be a lot of emotional trauma, not only for you, but more so for the people who are affected by it, whether that's the parents of a child that might have been killed or their family members, close friends, loved ones, etc. And on another note, public education has increased greatly in the past 10 years or so on the impacts of driving drunk and driving under the influence of alcohol, but that doesn't mean the problem's completely under control. There's always going to be people that make stupid decisions to drive under the influence. So public education has increased, but there's obviously still room for improvement. So then looking at the effects of cannabis with driving, when it's combined with alcohol, the effects can be additive and almost synergistic sometimes, which means that the sum of the individual counterparts is greater than that of each individual sum. So cannabis does slow your reaction time, impairs your ability to make good decisions, and impairs your perception, whether that be like depth perception or your mental perception of the situation and what's happening. Obviously, with cannabis, there's more inhibition of your behavior, so you're going to be a little more reckless, maybe careless. That can lead to more bad consequences. Similarly to alcohol, if you cause an accident, there's going to be all those legal consequences and the emotional ones that I mentioned earlier. And then with cannabis, it is a little bit different when it comes to testing for driving under the influence. So there's not necessarily like a quote unquote legal limit like there is for the blood alcohol content with alcohol. Cannabis stays in your system a lot longer than alcohol does, so it is a little bit more difficult to test because somebody can have cannabis in their system but not be actively under the influence of cannabis. So that does provide a bit of an issue when trying to determine whether somebody is under the influence of cannabis while they're driving. Obviously, you can look at their behavior, their coordination, reaction time, things like that to tell whether they're impaired or not, but it is more difficult to look at a strict hard number in terms of how impaired they might be, since it does stick around in your system longer. So then looking at the different states, these were just a few of the states that I picked out because they have legalized cannabis not only medically but also recreationally, which means it's available for people of certain age to use as they wish, similar to alcohol. So I looked at Colorado, California, and Michigan. Colorado obviously is pretty prominent and well known for its use of cannabis. They were one of the first states to legalize it. They obviously, all states, it's illegal to drive under the influence, but Colorado has a legal limit of 5 nanograms per ml of THC in the blood. If your blood level of THC is above that and you get pulled over for reckless driving or driving irresponsibly, they can test your blood and see that your level of THC is higher than that and technically say you are driving under the influence. They're probably not going to give you a blood test on the side of the road, but that is something that can be of consequence. And then one thing that I thought was really cool for Colorado is they have a campaign called Drive High, Get a DUI. Since Colorado is so prominently known for cannabis use, I thought it was really good that they had that campaign, not only for the catchy slogan, but they directly associate what the consequences are of driving high in a state where cannabis is pretty prominent. And they associate the DUI, which most people would think, oh, DUI, alcohol. This one associates it with cannabis as well, and it kind of just reinforces the dangers of driving under the influence of any substance, which I thought was really good on Colorado's part. In California, again, it's legalized medically and recreationally, and it's legal to drive under the influence of it. But they also had a clause in their law on it that said it's illegal to drive while addicted to a drug, which I thought was really interesting, as there are a lot of people that might have prescriptions that are legally prescribed to them for, say, like a benzodiazepine or an opioid, and they might become dependent on it if they've been on it chronically for, say, anxiety, or if they have chronic back pain, and it's technically illegal for them to drive there, which I thought was really interesting because it's going to be more difficult to determine whether somebody's addicted to a drug, whether they're actively under the influence of it. I feel like it could just get very gray as to what addiction is qualified as out there, especially when it comes to the driving aspect, because there are probably a lot of people, just based on the number of people that live in California, that have prescriptions for controlled substances that they might become dependent on, and then therefore quote unquote addicted, and make it illegal for them to drive anywhere. And then for Michigan, it is legalized medically and recreationally. And then obviously it's illegal to drive under the influence of it. It's also illegal for you to drive with any Schedule I substance in your system there, which I thought was interesting, as marijuana is technically still Schedule I federally, but it's legalized recreationally there. So I thought that was interesting. And then additionally, it's illegal to drive under the influence of alcohol, obviously, and any controlled substance, which I thought was interesting, because you can buy a substance like Benadryl over the counter, which is really sedating. You probably wouldn't want to drive on it, but it's technically legal for you to. It's just more food for thought. In conclusions, obviously driving under the influence of any substance that might affect your ability to drive properly and responsibly is never safe, smart, or acceptable. You don't want to endanger anyone that doesn't need to be endangered for stupid reasons. And obviously encourage those around you to practice safe substance use of alcohol and cannabis if it's legal where you're at. You don't want to drive under the influence of anything. And then take-home points: driving under the influence is very dangerous and can have a lot of serious consequences. Despite improving public education on the dangers of driving under the influence, that is still a problem that needs to be addressed and improved upon in the US. Driving under the influence negatively impacts your decision-making skills, your perception, and your reaction time and coordination. Obviously, that can lead to accidents. That's never anything good. And then it is illegal to drive under the influence of cannabis, alcohol, and or any other drugs throughout the country, but some states might just have different specifications as well that you would want to be aware of. Okay, and then there are my references. Thanks.